So I think we, Rajan,
Meet Jason.
okay. So welcome everyone to the next edition of our health and wellness series. Today, we are going to talk about a topic that most of you are familiar with, both either personally or through looking at someone in your family or friends. So it is about memory issues, memory problems, and dementia. And without much ado, we will introduce the speaker who is going to talk, Dr. Shaila Bokala-Puniti. She is the Director of Neurology in Inspira Health System, and she's going to educate us about memory problems and dementia.
Thank you. So this is one of the series of health and wellness series. We do this under the auspices of Seva, which is volunteering together to do service to the community. This is a service wing under the umbrella of Jet USA, started by His Holiness Chinnajaya Swamiji. So we have a local center here at 494 Beverly Rancocas Road, Willingboro.
Hello.
Some of the activities that we do include, providing education for the underprivileged, providing education to blind children, fundraising for natural calamities such as floods, earthquakes. We also run food drives all across the country. We also have started a program, and we are, I think, about 20 weeks or so into the program of offering fresh foods in New Jersey every week to people who have really triple whammy, who are underserved, poor, mentally ill, homeless. So this service is continuing. The next slide, Diego. So I'll get to the topic before any other delay. So memory lapses and dementia is the topic. So dementia is a general term. Basically what it signifies is a general decline in memory and your ability to think, resulting in impairment of your activities of daily living. So dementia can affect your speech as it progresses, language, reasoning, judgment, ability to focus, visual perception, and also ability to comprehend. Recently, you've probably heard about Bruce Willis. He was diagnosed with a kind of dementia which is much more rapidly progressive. It's called as primary progressive aphasia. So he is now basically without any speech, in addition to the cognitive impairment. So dementia is a gradually progressive condition. It's very insidious in its onset. Sometimes when the symptoms start, the family members sometimes don't recognize, let alone the other people, because they can mask very well by either counter questioning or even try to camouflage it a little bit. But it is a gradually progressive condition associated with inability. So initially when they start off, their social graces and manners are preserved, but as the condition progresses, they can't even recognize their family members. And they kind of regress to their childhood. It's almost like teaching a child all over again. It's like the cycle continues. So they need to be taken care of in every way. They're completely dependent on the caregivers. It can get very difficult for family because of the advanced dementia, because you see the family members' personalities lost day by day. The person is there physically, but the person the mother or the grandmother is not there. And it actually takes a lot of emotional toll because you lose the personality day by day, gradually disappearing. So this is not the mother or not the father or not the grandmother or uncle. And that's why the emotional toll is a huge burden for the caregiver. So what is the prevalence? After age 55, there's a 42% lifetime risk of developing dementia. So this basically translates to 1 million cases annually in the entire world, but 55 million globally and 7 million aged over 65 in the USA. Alzheimer's dementia is one of the types of dementia. There are different types of. It was discovered by Alzheimer. Dr. Allau is a German neurologist who discovered it. So the mortality with that is 60 to 80%. And if you look at it, it's only second to heart disease, coronary heart disease. So who are at risk? So the risk factors are several. First of all, the advancing age, people who smoke, people who drink alcohol, head trauma, lower educational status, loneliness, and of course the other risk factors is diabetes, high blood pressure, high cholesterol. And the people who carry this gene, it's called APO gene, apolipoprotein E gene, and some people have a family history of young onset dementia and they are at high risk. I'll just go back to that apolipoprotein 4. So if you're a carrier and you have one gene, you're at a risk. You're still at a risk, but if you have a double copies, there's a 2 copies, and your risk increases significantly, and those are the conditions that you can see in early onset dementia. As I said, types of dementia, so Alzheimer's is only one of them, but there's something called as a vascular dementia. What happens is you take a hit, say you have a small stroke, you may not even manifest any symptoms, but for whatever reason you get a scanning of the brain, either a CAT scan or an MRI, and you see old strokes in that, you may not even manifest. But over a period of time, this cumulative results in your loss of memory, because where there has to be a healthy, viable tissue of brain, you have these infarcts, which are dead tissue. That's what it is. The brain is dead in that area. This is a cumulative burden and manifests as this vascular dementia, known after the neurologist Vince Van Gogh disease. There's something called as a frontotemporal dementia, where you have personality changes. The cognition is fairly well preserved, but then, like, a patient comes in and he's literally eating more than what he can chew. There's no social manners or decorum. He's like gluttony, or even grabbing from his children's, lunch boxes and eating food. So there's making all lewd comments. Basically, there's no screen or filter. It's like, you're totally uninhibited. That's frontotemporal dementia. And there's diffuse Lewy body dementia, which is characterized by a lot of hallucinations. They see things that are not there. Then they have a lot of stroke-like symptoms, in addition to the memory problems. Then there's Parkinson's disease with dementia. You have, the Parkinson's disease and then the dementia associated with it. These 4, which is normal pressure, I will touch these in the next few slides later on. So, but then they are there. Those are the 4 conditions where you have also dementia manifesting. There's something called as age-related memory lapses. So as we age, we're not as quick in processing, we're not as quick in comprehending, we're not quick in even retrieving. So you say, oh, I have it at the tip of my tongue, but I can't get it. But in a few minutes, you're able to get it, or a few seconds. So that basically entails it on. Your activities of daily living are not impaired. You just cannot recall. Like, I feel like, I used to ask Jeopardy questions so quickly, like, at the tip of the tongue, but it just takes a while for you to answer now. So you also have difficulty with multitasking. Before you do so many things, your focus and concentration also decreases. But these are all age-related, not necessarily dementia. So then we also see people who are worried, well, I'm aging and I'm like slowing down a little bit. Do I have dementia? But their activities of living, daily living are preserved. They don't have any problem at all, but we call them as a worried well. Again, the key thing with this is they do not impact your activities of daily living. You can do everything on your own. You drive, you don't get lost. You have, your processing is slow, but it's still preserved. So occasional forgetfulness, misplacing keys here and there, forgetting names. If you haven't seen them for a long time, you have difficulty recalling, and I don't remember the name, but you remember the face. So, and key thing, the judgment is preserved. So they can do everything. Their planning is good. Their executive function is preserved. And most of the times what we do is there are reversible causes. So we check for thyroid, we check for B12, we check for folate levels to make sure that those are normal. So in vegans, particularly, there is no source of B12 because B12 comes from animal source. So when I say vegan, they don't even eat, milk and milk products. So vegetarians eat yogurt, and there is yogurt you get B12 from that because there's bacteria there. So they are the people who are on B12. If you supplement them, the memory comes back from the, that's it, exercise, stress, anxiety management. All these actually improve the symptoms. So we come to this mild cognitive impairment. It is actually precedes. It's a step before the dementia. This is the step actually where we need intervention. So we do that reversible blood work, which is B12, folate, TSH. If you have diabetes, but this is a stage where you actually have medications now, which are infusions, which can actually kind of not prevent, but actually treat. But this is the stage actually we have to detect it early to actually do the treatment and intervention. This condition precedes, like I said, dementia. It's actually between the normal aging process and memory lapses and dementia. So it's intermediate in between. Again, this is characterized by forgetting things, word finding difficulty, but it is much more significant than age-related lapses, age-related cognitive lapses. But again, once again, their activities of daily living are preserved, judgment is still preserved, and they continue to be independent. So MCI mild cognitive impairment can lead to Alzheimer's dementia, but sometimes it can actually be stable and not improve as well. Sometimes it's just there and MCI, we continue with it. So we go to Alzheimer's dementia. The most common form, like I said, it is characterized by short term. So initially when it starts, only short term memory loss. If you ask them, what did you eat for breakfast? Or what did you eat for lunch? They can't recall. But the remote memory is preserved. What did you do when you were a child? Or what did you do 20 years ago? That's perfectly preserved. And then language impairments come later on. It's a prominent part of the dementia. Usually their grammar is lost. So they miss their is or the verbs or the definite articles a and the, that's what it starts off with. The fluency later on actually is also depleted, and they have long pauses. They can't get the word. They struggle. It's like fumbling for words. And naming the objects, they can name the object, but you ask for fine parts of the object, they can, the overall picture, they can get the one part of it. Like if you ask what's it, it's a clock. But if you ask what are those, those hands or spokes, they can't name it. And more importantly, they have problem using gadgets. So they had no problem using a microwave before, and now they have difficulty using microwave or remote control, normal, you're operating the TV or the other cell phone for that matter. They also lose the spatial disorientation, and this is when they get into difficulty because they can't gauge the next step. Sometimes they trip and fall as well. So fall risk is there with that too. Difficulty with calculation and right left differentiation. So turning left and turning right when they're driving, driving is affected as well. So what are the signs and symptoms? We actually talked about it, but memory problems disrupting daily life. In order to form memory, actually there are 4 steps. 1, you have to hear. Your hearing should be. The second step is actually you should be able to register what you hear. The third step is actually there's something called as we don't even know, but it happens, the protein folding. It transforms into protein folding and it's there. The fourth step is the retrieval. In this case, there are so many problems at every stage that they keep asking the same question over and over because the registration is a problem. They don't register, they ask the same question, call that as a perseveration. They keep asking the same thing. They're not able to remember their appointments. They go to the grocery store, they're heavily reliant on the list or somebody else to remind them. All these that they could handle independently. So there is some degree of frustration and helplessness as well because they keep saying that I can't do the things that I used to do before and I am relying on so many notes and reminders for me to do things. So they have problems with planning and solving problems. So before they used to pay bills on time and they become delinquent, they're not paying the bills on their time, they forget that they pay or they pay for a second time. So the difficulty balancing their checks bounce back, and that's another financial stress as well. And then again, the difficulty with using the gadgets, misplacing of course, and normally in normal aging, if you misplace and then you retrace, you're able to go back and retrace and recover. In this case, they can't do that. So, and then confusion with time and place, everything gets so muddled up for them, like, the sequence of events they can't remember. And then they get lost. They have driving to the same places where they used to drive, they have difficulty because they can't follow the familiar places and they get lost often. They of course then have problems with writing, speaking, word finding difficulty gets more prominent, like what happened to Bruce Willis, and then finally they just can't speak at all. And what happens while all this going is there's some amount of loss of confidence. They're not confident because they're saying, I'm struggling for words, the words don't come out right. They have, socially they withdraw. So then social withdrawal, loneliness is again a vicious cycle. They get more demented from that too. Then there's also personality and mood changes. They become very depressed. They do not have any judgment and insight. So sometimes all these money lenders, that's what money lenders, people who actually, the telemarketing people, they exploit these people, demented people. They try to call them and sometimes they're donating for stupid causes, whatever that, they don't even realize that. Difficulty then, visual imaging is, the spatial relationship is again, they're lost, they can't. So if they're driving a car, that's why it's very risky. They have to give up driving risky, but it's like taking away their independence. But at some point you have to because you think you can turn around, but they have difficulty with that spatial relationship. They end up accidents, fender bender, or sometimes even severe accidents. So again, short-term memory is impaired, but as the condition progresses, there's confusion with everything, and everything gets so muddled, and eventually the remote memory is lost as well. So in the early stages, they recognize the family members, pretty much even the face and the name, but as it goes, they recognize the family members as family, but they won't be able to remember them. So like they recognize the daughter as a family member, but not necessarily their name. But as this condition progresses, they don't recognize anyone. Usually the caregiver is usually the daughter most of the time. They think that that's the mother because they think they're so regressed, they think that they're child and back to child. Sometimes they ask like, oh, I have to go home, I have to feed my children because they're coming from school when they're like 80 years old. So they don't remember. Even the current house that they live, they probably might have lived for 30, 40 years, but they still ask for the childhood home. They forget everything. Then the mistake that the children are young, and then paranoia as well, though. So if they see from the shadows, they see a tree, they think somebody is coming to kill them or somebody is coming to hurt them. Some people think that the husband's having an affair with another person because they see visual hallucination. They see a person actually. They really see. There's such a formed visual hallucination that they believe in it. So a lot of times they think that somebody else is there, and there's a lot of medical problems from that too. So initial stage, I said, because the social graces are so preserved, they go unrecognized. Family members who are keen can actually pick up that, or when they go to the doctor. But most of the time, they don't go to the doctor because they think it's age-related. They kind of procrastinate on that, and they manage to conceal pretty well the patients themselves. So all those we discussed. And there's something called as a sundowning. So usually during the daytime they're okay, but once the sun sets, they have problem at that time because then they have visual hallucinations, they get more confused, especially in unfamiliar places. If they get hospitalized, they just go berserk because it's a strange atmosphere, strange environment, strange people coming in the middle of the night checking your blood pressure. They just go so wild. Often they try to look, so that's again when the caregivers have a problem with that. They have to make sure that it's all locked and all. They just don't realize it's night or day and wander. Then they have to call the police to bring the patient back. So it's an enormous burden for the caregivers. How do we diagnose? So we talked about the signs and symptoms. How do we diagnose? So MRI is actually the tool for everything. It evaluates the extent of brain loss, but more importantly, the areas where the brain loss is also tells whether it's personality changes that are more affected, or is it just the memory, or is it the visual part. So that's why MRI is the tool for it. Then the PET scan actually, when you actually have to start them on treatments, the sensitivity and specificity is very high. So it's high if it is negative. Then we have the gene testing for people who have the apolipoprotein E for young onset dementia, but also presenile mutations can cause too. So if there's a family history, we go for the genetic testing, but it's not most of the time it's not approved by insurance companies. So this is just to, this is the one. So you don't need a doctor, but it's not so clear cut most of the time. It's not black and white, it's in the shades of gray. So here you see a novel gray. These we call as the sulci, and then these as the gyri. So if you see that and that, there's a lot of, this is a whole brain, like a whole brain from a deceased person. But if you look at that in Alzheimer's dementia, it is. And you look at this, it's a pathology cross section. If you look at that, these are the cavities. And look at the cavities, how big they are. Those are the ventricles. So you see how it is, and if you see vascular dementia, you'll see also the strokes that are happening, the burden of it, accumulated burden of that you can see. And this is just to show that what happens at the pathology is there are clumps of protein called amyloid, and then there's something called the tau protein. What happens is basically they clump together these proteins, and then they get lodged in the brain tissue. And what happens then they twist around and they choke off the brain cells, the healthy brain cells. And so as these accumulate, the burden accumulates, then the memory problems. And the brain cells die, and of course it shrinks. So that's exactly what happens. So the tangles and the amyloid plaques. And this is where actually people have intervened. How to do it is to deplete this amyloid plaque. And that's the treatment for it. We'll go to the next slide. So the key thing from this is you don't use it, you lose it. So you've got to use your brain for whatever. So cognitively challenging exercises can delay the onset, even if you have the risk factors. But the best thing is if you're a smoker, quit smoking. If you're a drinker, you drink smoking, and of course all other drugs too, and all other illicit or recreational drugs. Then learning a new language actually helps. Learning a new instrument, musical instrument can help. So just as we keep our body fit, we need to keep our mind fit as well. And that's why you need to have all those exercises. So the treatment is the first category, these oral medications. They don't prevent or treat, they just delay the onset. All those that are listed are this there's a patch, there's an oral form. What they do is they just delay the onset. These are the medications, and the stage to intervene is the mild cognitive stage. You have these are IV infusions. Now most of the insurances approved, including Medicaid. So there are like 3 of them, of which one is discontinued, but pretty much these 2. But it is kind of very invasive in the sense you need to have a PET scan prior to that, then you get an infusion, and then you get several scans afterwards to look if it's working. Because what you're doing is you're measuring or looking at the amyloid plaque burden. So this reduces the amyloid plaque burden by binding to the amyloid beta protein. This is a book actually, I always tell the patients' caregivers to use it. Tom and Karen Brenner actually are social workers. They wrote this book. It's a very nice book. You say goodbye and we say hello because the family members cannot deal with it. It gets to the point, not that they don't love them, but it gets to the point that they can't deal with them anymore because, people have to work, right, for a living. So if they elope from the home and all that stuff. So these people have written that there are people who actually take care of them, like adult daycare centers. So then we come to chronic traumatic encephalopathy. Where do we see this? We see in these football players. That's recurrent and repetitive head trauma. At age 30 and 40, they have signs of dementia. This is irreversible because the damage is done. There's nothing much to do for them. Unfortunately, these people risk their lives for entertaining the rest of the world, I guess. But they take a big hit. So the more hits they take, the more hits they take, the more of damage they have, and obviously. So football players, recurrent head injuries, biopsy always reveals that what the age patient, you see these amyloid plaques, it exactly looks like an Alzheimer's patient of 80 years or 70 years old. What do they manifest initially is personality changes, mental fogginess, depression often, irritability, aggression, impulsivity. They also have confusion, impaired judgment, executive dysfunction, and a lot of football players, a couple of them actually committed suicide because of all these. They get so paranoid, they get all these language difficulty, and these are only 30 or 40 years old. It's very sad. Next one. Alcohol. So people who think alcohol is benign are absolutely wrong. It is heavily neurotoxic. So even minimal drinking can wreak havoc in your brain. So a recent study, actually 2025, it's 500,000 adults they've seen in USA and UK. They published it. The amount of alcohol increases the dementia risk. So even if you're drinking light drinking, it still has 15% risk of dementia. If you're drinking anything more than that, that increases exponentially. What it does is it attacks an area called cerebellum, which actually controls your balance, memory, and your speech. That's why the alcoholics speak like that. They have stagnant gait. They can't maintain the gait. They fall, and they have bleeds in the brain. Normal people fall. We don't have because architecture changes with alcohol, so they bleed easily in the brain. And then it causes a huge volume loss of the cerebellum, which controls your balance, speech, and memory. So, and then what you do is alcohol depletes the vitamins, particularly B1, which is called as thiamine. And then what happens, and they don't have any appetite because it kills the appetite. All they're doing is drinking, not eating. And I'm talking about not light drinkers, but who are pretty much addicted. So they have a double whammy. They have the B thiamine deficiency, and that causes horrible varices encephalopathy where they have confusion, lethargy, tremors, and they're like, they can't function at all. They can't walk, they can't stand, let alone walk. So they have severe deficiency of B12 as well, and folate. There's a condition called normal pressure hydrocephalus, and this is actually reversible. We saw those cavities in the brain, right? So we call it as the triad of wet, wacky, and wobbly. Wet is they have urinary incontinence. Normally they were fine, and all of a sudden they lose control of their bladder. They were walking fine, and all of a sudden they trip and fall for no other reason. And then the wacky is they're just memory problems. So very insidious, and when people who have normal cognition become suddenly forgetful, lose bladder control. And why this happens is accumulation of fluid. Now, fluid accumulation is because you're making more fluid, cerebrospinal fluid, or your drainage is something. The net result is the same as the accumulation of fluid. So is it a drainage problem or you're making more fluid? Because we make about 300 ml of cerebrospinal fluid every day, but we also drain it. So either the problem is with making excess or draining less, and the cumulative factors accumulate that. So that exerts pressure on the brain, and you have urinary control in the brain as well, so that's why your bladder control is lost. The treatment for that is we put in a small needle, and then we do the spinal tap, just like when you get spinal anesthesia, it's the same thing, so that hurts more, or for that matter, people who go through, women who go through delivery do the epidurals, right? So it's the same thing. You drain the fluid out, so you have the patient walk first, they barely are able to walk. You do that, it's a dramatic improvement. They're able to walk without support. So that is an indication. So that's only temporary, right? And it may accumulate in like 3-4 weeks. So then we do the VP shunt. We put in a shunt here to drain it constantly. And people do very well with that. So that's actually treatable. It's a temporary condition, as long as you go and seek medical attention in a timely fashion.
Where is the drained fluid goes?
So the drain is going to the peritoneal cavity, not into the stomach. So we have this peritoneal cavity where you have your colon and all. It doesn't go into that. It's outside the gastrointestinal
So
system.
that has
it drains
connection.
It's inside. It's
Inside.
from there and then to the neck and then put it in there. So this is actually a very rapidly progressive condition. It's rare, rapid, and unfortunately fatal. There's no treatment for that because the mechanism of transmission is prion. It's not bacteria, it's not virus, it's a protein. The only way you can get rid of the protein is autoclave, like high 300 degrees or something like that. You just have. That's the way you can actually denature the protein, but very, very contagious. One of the variants which we all know is a mad cow disease, which is a variant of the CJD, but it's not. It's named after Jakob Creutzfeldt. That's what it's named. Jakob and Creutzfeldt together, both of them. So not all the cases are from brief consumption. Some of them we don't know exactly what happens, but it's usually through, if you get the variant of CJD, which is mad cow disease, it's through beef consumption. But recently, actually, in our hospital, we discovered 2 cases recently. It's not published or anything with this, but this is after consuming venison, which is deer meat. So people are now hunting, they go, and then it's game food, they eat. But recently we've seen 2 cases. We're suspecting that's from venison, we're not 100% sure. So they have impaired thinking, talking, even swallowing, and so they get very emaciated, they lose a lot of muscle mass and everything, and very rapidly progressive. Within 1 year, sometimes even within 6 months they die. Blindness, insomnia, blurred vision, it's a horrible condition because they know there's nothing much to do for them, and they know it's so death within a year, usually 6 months. No treatment, and they have seizures as well, and constantly jerking movements, violent jerking movements. We can treat the jerking movements, we treat the seizures, but eventually they will die. So what can you do? We learned a lot about this. So you have a control of what goes into your body. So you have to take charge. So healthy nutrition, again, plant-based protein is better, 5 servings of fresh vegetables and fruits, regular exercise, not only for the body, but also for the brain. And then again, processed foods, try to minimize processed foods. I know we have to sometimes, but if you can add more fruit and vegetable, water as opposed to sodas, and of course, big no to alcohol and smoking. Next slide. And what can you do? So we tend to use a calculator. I know we have a lot of gadgets at our disposal, so we do that, but try to calculate. So you're doing an exercise for your brain when you're doing that. Cognitively challenging exercise like word searches, crossword puzzles, Sudoku games. I often tell my patients, if you can come up with 12 words within a minute, starting with letter A, or pick another one. Or you can have these games, or name all the vegetables you can within 1 minute. Can you get 16? Can you get 20? Name all the flowers, name all the cars. There's so many things, you can do. These kind of things actually keep you, sharp, because at the end of the day, you want to have those dendritic connections between the brain cells. So again, physical fitness is also important, and learning a new language, learning a new instrument definitely helps. And of course, if you have diabetes or blood pressure or high cholesterol, these 3 have to be controlled because they're big risk factors. So you have to get that under control. I think that's it, right? Yeah. Okay. Any questions? I'll take.
I think I heard like loneliness you mentioned, right? So people who don't talk also
Yes.
goes down.
Yeah.
So I think that is the make sure like if your elders are alone, try to talk to them more often, right?
Yeah, absolutely. Even a phone call every day.
Phone
can
call,
help.
yeah.
Because keep in mind, these are the stimulation.
Can you repeat the question for the sake of everyone and then
Sure,
answer
yeah.
so that
So The question is actually loneliness because they are not talking to anyone and they're very enclosed and withdrawn to themselves. The dementia can be, onset or it can get worse. Absolutely, because we need stimulation. Hearing impairment also is a problem there because you don't hear and then you can't register, of course. It's the same thing with loneliness. It's become a big epidemic as well in USA. So even a phone call every day to your loved ones will actually help them because probably that phone call is the only conversation that they have for the entire day.
Does treating the depression and anxiety that is like comorbid with depression or the dementia, can that help reduce the decline?
Definitely. In fact, sometimes you may not have as much, at least they're not as pronounced, the cognitive impairment. You can even manifest as dementia, so depression and anxiety. If you can treat them, yes, definitely.
Can I ask a
Oh,
follow-up
sure.
question?
Yeah.
Does that treatment look different from treating somebody with depression and anxiety without the dementia?
No, it's pretty much the same. You're treating the anxiety and you're treating the depression, right? So these may be the initial symptoms before the dementia manifests. You're exactly treating the same way. The same, antidepressants or anti-anxiolytics.
So one of, go ahead.
Somebody asked a question, Andy,
Yeah.
from the chat.
Yeah.
Can chanting a shlokas, things like that? Will
Yeah, in fact, I was going to, but I didn't know what it. But learning new shlokas, learning by rote, will also help because it's like learning a new language, learning a new instrument. But yeah, same thing. Chanting. I mean, if you can chant Hanuman Chalisa by rote, yeah, absolutely. If you can chant Mukundamala by rote, absolutely. If you can chant Tirupavai by rote, yes.
Does reading improve memory?
Reading can sometimes be passive, but something what I do is you read and you can shut it and summarize and do the gist of it. And because sometimes you think you have a strong hold on it, but you can't recall what you read later.
So
That often
something
happens.
memorizing things
Yeah.
activate
Yeah,
your
or at least you can read a
memorizing.
book and if you can just see, hey, what did I read? You can give a gist of it, you can get a gist of it, that helps. I mean, reading a book is definitely better than watching TV.
Right.
TV is absolutely passive, right? You're not even using any of your brain cells.
And the book is talking to you, you are immersed into it. If you have that kind of a relationship with the story,
Yes.
I think that is quite beneficial.
Yeah, absolutely. Even if you're watching TV, like sometime back we were part of a psychoanalytic society. We used to watch a movie and then discuss about it. So discuss about the character or what you like about it or the personality or whatever. Then it helps. But if you're just passively watching a movie, then I don't know.
One other question, we have a person known, he is not able to recognize certain people that in the family. So is it too late for any?
No, actually it's not too late. What you should show them is the pictures and say who is this. Often you could pick up, nowadays it's not album.
No, I mean, is it too late for any kind of medical intervention? Like you had some of
the IV infusions,
Aricept or those kinds of things. Is that
Aricept you can start at any time. It only delays. It really doesn't reverse. The reversible
we are actually looking for a delay. We are really not looking for.
Okay, so very initial stages, you absolutely get on board and get the Aricept or rivastigmine patch if you don't want to take.
Yeah, right. So after 10 years, if you can prolong being able to recognize family members, that's a good outcome.
He still is independent, he or she is independent with their activities of daily living?
Couldn't say not terribly independent, but able to sit, sleep, do certain things on own, but there is some dependency.
Okay. I mean, if they can do some chores, it's better. Any household chores like folding laundry, anything else.
And I think that's out of the the person cannot do that, but he can take care of his own things like going to the bathroom, coming back, taking shower, those kinds of things he can do very slowly.
So you want to preserve all those functions. You really want to because they slip away. So you want to preserve that. So I think you should get on board with Aricept. I mean, if they can't tolerate transdermal patches, pretty good with this.
Is Aricept that kind of thing now over the counter or no?
No.
No, not yet.
Yeah, all of them are prescription.
All are prescription. Okay. Any over-the-counter thing that can help that?
I know they advertise. What is it called? A Nupro. they advertise to DTC people. I mean, the patients come and ask. It costs a lot of money, but it's not FDA approved, and the company is making a lot of money. But that's what they advertise on TV, advertise everywhere. They call it as Nupro. They claim that it is.
Nuriva, something like
Nuriva.
that.
No,
That is the Walmart brand.
Nuriva is available, but it's like taking a vitamin.
It is more like a supplement.
Yeah.
It's not like a.
No,
what
yeah. It's not,
it's
but they
not-
claim that actually the memory gets better, but it's not.
Okay. Nuriva. correct.
Nuriva, yeah.
So we all know that marijuana is legal in New Jersey, and so what is the impact of marijuana use on cognitive function?
We don't have long-term studies, but short-term studies have definitely shown that you can develop cognitive deficits over a period of time. Meaning like psychosis is seen, paranoia is seen, and they do develop memory problems as well. But then it's a catch-22 situation, I prescribe for seizures, I prescribe for chronic pain. It works like a charm. It's like risk and benefit, you have to have pain control, right, to function. If you're in chronic pain, you get depressed too. You have pain every day, you wake up with pain, you sleep with the pain. So it is prescribed for that reason, so there's some benefit with it, but long term, I think it does impact your memory.
I understand that it's mostly hereditary
Mhm.
through the apolipoproteins and other things,
Mhm.
and also the diet, which is alcohol
Mhm.
and the junk food. But how does trauma or shock affect this?
Good question, yeah. I know you're alluding to psychological trauma, right? Yeah, definitely. So people who've been through a lot of trauma or lost a lot of people, like if they lost, children particularly, or in a traumatic situation, lost parents,
Any deep state of shock?
yeah, definitely affects your cognition. Yeah.
And there is another question on YouTube. Does Shravanam
Shravanam also help improve memory.
Shravanam again can be passive, right? You're listening to someone. Again, if you listen and at the end of the Shravanam, if you can recall what you read, that's an exercise for your brain. Passive Shravanam, I don't think it is. I mean, we hear, like Swamiji is talking, we listen so much. How much do you actually
don't
know?
remember, yeah.
You feel like you have it. It's like a slippery slope. You feel like you get everything of it from the lecture, but once you walk out,
So
how
if
much
you write down the summary of what you
yeah,
heard,
if you write down the summary, go home and read, because they say if you do read 3 times,
One
it
night.
sticks in your brain. Yeah, 3 times if you read whatever you read, this chances are that it sticks and then you remember, you're able to retrieve. It's there actually, when you hear something, it's there. Like the second time somebody repeats, oh yeah, I read it. So the retrieval is a problem.
So writing is what helps.
Yeah,
right?
absolutely.
Right.
So I think along with reading or listening, performing some exercises post these activities
Yes.
by ourselves
Yeah,
helps this
exactly.
improving the
3 times.
She writes for her, like, she has been used
like
to.
using active recall. That's like
Right.
something that I use a lot to study.
Yeah. That's actually good. That's where even when like you undergrad college, when there's lecture going on, if you write,
Yes.
then I think you remember. You go home and then read it.
I have to write. I can never type. If I type, I don't remember.
remember. Yeah.
I always see these flashcards to write.
But you have to remember that when you hit 70 or 80 years of age.
Yeah.
So
I'm also
that's
like
where actually the what you call problem starts.
Okay. So one other question, if chronic stress, impact of chronic stress on, does it make it worse? The dementia contribute to that, or like? any
definitely
study?
contributes, definitely works. And that's what Hilpriya said, right? It's mental stress going through a blow in your life, severe blow definitely adds. I mean, it takes a hit, just like physical trauma does in mental as well. Definitely impairs your cognition.
So then if they are treated effectively, then that is a protective thing.
Oh, absolutely. And people who, I mean, there's also some age-related memory loss you have. You may not be, you're someone who doesn't get stressed with anything, or you're fortunate enough to not have any blows in your life. You still may have, right, some cognitive slowing, but definitely you can ward off dementia by managing your stress.
Next stroke and get
I think learning Bhagavad Gita will help in that case, I think.
Yeah, learning
Learning
Bhagavad
Bhagavad
Gita.
Gita and
Yeah, I mean,
practicing
one of our
it.
friends has done all 1700 wrote.
No,
So
not
that's
only that, I mean, basically, Bhagavad Gita has all the concepts that will teach us how to handle stress, how to handle
Oh, okay, yeah.
any trauma situation that you're saying.
It teaches, but how much you can implement is another thing, right?
Probably.
Right.
It has so
Very
much to
accurate.
offer, but how much you actually can incorporate in your day-to-day life,
Yeah.
and how much you
Learning
implement
and
in
recalling.
practice.
No, so the part is that what to do, like Bhagavad Gita tells you what to do. The difficulty most people have is how to do it.
Yeah, following it.
Yeah, okay.
Following it is.
Yeah, if you say Sukha Dukkha Same Krutva.
We all
okay,
know that
when it is
treat
Dukkha,
everything.
what do you
But
do?
can you treat death the same way as a birth? No, you don't.
Yeah.
You cry over death, you rejoice over birth.
Yeah.
So it's all there, but for us to implement it in our
I think that
day-to-day
is
life
there.
is
How
a
do you
big
translate what is?
And I think if you get to that stage, nothing will bother you. Nothing, absolutely nothing will bother you. You get money, you lose money, you do that, you lose a loved one, nothing bothers you. But to get to that stage is a big thing, right?
What we have seen is that Bhagavad Gita is simple Sanskrit, so you learn the Sanskrit language.
Exactly,
Yeah.
that's right.
So you're listening, you're trying to memorize that, so it increases memory. And third is it has the concepts where you can actually handle all the
All the stress,
and
exactly.
related things. And day one will not be able to follow any of
Yeah,
those.
yeah.
But
Anything
as
like
we
abhyasa,
continue to
right?
hear,
You need practice.
it will come automatically.
Yeah. Krishna himself said, abhyasa vairagya, right?
And probably reciting them to others and
Yeah.
exercise of sharing.
So that's one actually thing. Like when we listen, we don't know whether we understood or not.
Mhm.
Swamiji also says that if you try to teach, then you understand, oh, I didn't really understand anything. So I need to go back and really learn. Right? So trying to teach actually helps you even learn better.
Absolutely. Normally, Bhagavad, in general, anything.
Yeah, anything.
Every time you're teaching, you're actually learning. There's so much. I mean, even the same thing you're teaching, but you're learning. There's a different perspective you come up with. So,
Where we can comprehend the message of that sloka
Right.
and then again preach it to someone else.
Yeah.
Discuss
and
it.
even if you know the meaning of the shloka, the second time you do it, it's a different
Yes.
perspective altogether. So,
Any food, like, I mean, we know that alcohol is not good and even the meats are not good, right?
Everything is
So basically,
Everything in,
rajasic and tamasic foods are
everything
not
in moderation is
sattvic
good.
food is the best.
Sattvic food is the best. And in
And
sattvic,
add nuts. I know, our sattvic, I don't know the emphasis, but add nuts, more fruits and fresh vegetables, fresh fruits.
okay.
Cooked food, it's really the vegetables, if you cook overcooked, also is not good. So salad a little bit. You can eat cooked food, but salad, some nuts into the diet. You can incorporate that.
Okay.
ఈ ఆల్కహాల్ విషయంలోనూ రెడ్ వైన్ స్మాల్ క్వాంటిటీ తీసుకుంటే చాలా
Now actually,
చాలా బాడీకి చాలా ఉపయోగం అది ఇది అని లాట్ ఆఫ్ ప్రమోషన్ ఈస్ గోయింగ్ ఆన్
not
సో
anymore.
దట్ ఈస్ టోటలీ
Not anymore. They used to say actually a small amount of wine is cardioprotective. Not anymore now.
నాట్ ఎనీ
Yeah, so not
Just
anymore because
now.
now even the Surgeon General says alcohol is deleterious to your health. Surgeon General warning is there on alcohol, and I'm glad that they did that. Because before they never used to. So
There's
More
another,
questions, Andy?
there's another comment in YouTube where she commented in Bhagavad Gita, Krishna says, she's quoting a sloka, Yukta Hara Vihara, so everything in moderation is good.
not alcohol.
Yukta Hara, that's all. Alcohol doesn't fall under Yukta Hara.
Okay, that's
Thank you.
Okay.
Thank you for everyone for joining.
ఒకసారి మన స్పీకర్ గారిని
Okay.
సత్కరించడానికి ఒక స్మాల్ గిఫ్ట్
No,
తీసుకొచ్చాము
no,
ప్రెసిడెంట్ గారి ద్వారా ఇప్పిద్దామని
No, but let me announce the next week.
Yeah.
That concludes our session for today. In 2 weeks' time, we have a session on stroke. That is not next Saturday, but the week after,
In the morning.
Time?
in the morning, at 10 a.m.
Saturday.
Thank you.
You're all volunteering, and
No, thank you so
Parle,
much.
this-
It's really, really wonderful. Every couple of days we are getting a lot of information from Dr. Rian.
Thank you, and
Thank you.
Thank you.
All these blessings.
Very nice. Lot of research చేసి కాన్సైజ్ గా ప్రజెంట్ చేయటం lot of it takes